Good evening, everyone. Welcome to the Iraqi Student Surgical Society's webinar. Today is our first embryological webinar. Our guest today is Dr. Omar Ammar, and we'd like you, of course, to introduce yourself first. Any questions, you can write them down in the comments, and we'll get to them at the end.
Good evening, everyone. Thank you, everyone, for having me this evening. Especially thanks for the invitation, Hussam. I'm Omar Ammar. I go by both names. I'm a clinical embryologist, senior clinical embryologist, and researcher in fertility preservation for female cancer patients. I'm a Chevening Scholar. I obtained my master's degree in Dundee, University of Dundee, in 2018. And I have been working as a clinical embryologist and researcher for the past, I think, 6 years. I also joined University of Oxford as a research assistant in ovarian tissue culture. Yeah. So yeah, I just want to say two things: that I'm not a medical doctor. I am, and I'm not a doctor yet. I come from a sciences background, and I want to emphasize on another thing is that in this, by answering the questions you have, I only represent myself and my own experiences and my views. I don't represent any of my current employers or former employers. Thank you.
Thank you for your introduction. Now, can we get to the questions? Because we're all very intrigued to ask you different things. We haven't really had the chance to speak to someone in this field before, and we're very curious to see. So some of the questions we have here, the first question we all want to know are, what are the advantages that you love most about working in this, in the embryological field? Your personal view.
Yeah, thank you. That's a very interesting question. I think I like embryology and working in embryology from different perspective. I would say first, as scientists, we either work on fundamental sciences or translational sciences, always in the lab, hidden in the lab. And I think embryology is that unique science when you are translating actually some bench work in the lab into the patient bed. You are dealing with lab stuff, but also you talk to patients. You are involved in their clinical decision and the clinical consultation and journey. This is one aspect I like about embryology. The other thing, you are helping couples to have the most precious thing in life, which is babies, to give them their own babies, which is like, I think, seeing couples happy or seeing them like having a positive pregnancy test or even a live birth, and how they cry, how they react to this news. It's always like, I thought that I would be used to that feeling, but every time I get taken by it, and almost I get tears in my eyes. The other thing, I would come to the practical also aspect. I think the field of embryology or reproductive technology in general, it's pretty young field, and there's a lot of room for improvement, to invent stuff or to find new processes and things within the field. So there's room to actually contribute to the field.
We were actually curious to ask you more questions about this because, as you said, you're very happy and it brings you tears to see couples. Me and my colleagues had discussed questions that we wanted to ask you, and the major one that was on our mind was, do you ever feel pressured when speaking to these couples that, you know, they've been trying to conceive a child for about 10 years, maybe even more? So do you feel pressured when you first encounter them? Do you feel pressured by giving them any, you know, not being able to give them promises that they obviously want to hear? Because IVF is usually, you know, the last hope, the last step.
Yeah. So obviously, there is. I would just speak according to my experience, and I will focus on the practice in Iraq. Maybe this is not really, let's say, not to be generalized for all the practices around the world. For Iraq, I would say, when the couple comes to the clinic or the lab, they expect you to give them a baby by the end of the process. And actually, things just don't work simply like this. There are so many determining factors in the success of an IVF cycle, and the most important one is the age, especially for the women. Uh, if you are above 37, 38, it's very difficult to get pregnant due to decline in oocyte or in eggs quality. And there are also other factors like male infertility and so many others. Personally, in our practice, we do our best not to overpromise and to lay the facts to patients and to give them a realistic success chance, and we make them make the decision with us, like let's say an informed decision. This is your possible success rate. We don't really know. This is your case, and we expect this certain success rate. If the patient agrees, approves, we go forward with the treatment. I think the most difficult part in counseling IVF couples is actually delivering the news after you do the IVF. Delivering the news, especially the bad news, it's always very tough decision. I think we need to be very careful. We use very delicate language, and we need to approach the situation to be a bit, let's say, empathetic, very like we should be concerned about the patient's well-being, and yeah, we try to explain to them why the IVF cycle actually failed, and what the possible future solution for them. Like straightforward, I would say straightforward cases, most of them they get pregnant. But complicated cases, most of them they need to try more than one time. For example, if they have fresh embryo transfer, then we try with a frozen embryo transfer or maybe another cycle. So yeah, it's a very difficult, I would say, roller coaster of emotions and decisions to make.
When the unfortunate minority does occur and it does fail, how do people deal with the expenses? As we know, IVF is a very expensive procedure. So, how does that work? You know, especially in a country like Iraq, where it's become a major problem now, the financial cost for health and the fights that could happen sometimes between the patient's family and the healthcare system. How do you deal with this and the failure rates?
Yeah, so just to give you some background briefly, uh, almost 90% of this is anecdotal, of course, there's no statistics about this. Almost 90% of IVF in Iraq is privately funded, is funded by patients themselves in private centers. There are a few governmental IVF centers in Iraq, but also they are not entirely free. You have to pay almost more than 1 million Iraqi dinars, 1 million, 1.5 million Iraqi dinars to get IVF in the governmental centers. I would say upfront, we tell patients that if you decide to go with the cycle with this success rate, the only thing, if the cycle, if we don't have embryos to transfer, then we will reimburse the patients only what costs for embryo transfer. But if we actually have embryos and we transfer embryos, then there's no pregnancy, the patient will not be reimbursed because this is upfront expectations that are given to patients. But also IVF is a very, very, very expensive process, from the hormonal injections to stuff we use in the lab. It's a very expensive uh, complicated process, I would say, especially, yeah, you need a specific environment and specific quality control and care to actually make embryos in the lab to transfer them back to patients. Yeah, long story short, if we have embryos, then we transfer them and no pregnancy happens, we don't reimburse. If no embryos to transfer, we reimburse only the cost of embryo transfer.
Okay, so it turns out that now we do have governmental supported clinics in Iraq, but I still see most people, maybe the vast majority, are seeking this type of healthcare in different countries. My relatives, I know people who would usually travel to do IVF. So when do you believe will it finally be established in Iraq officially, where it will be 100%, not 100%, but successful enough for people not to travel and to depend on Iraq to give this procedure and the techniques for it?
Yeah, so to be honest, I would disagree here. So maybe 10 years ago, we had only one, two IVF centers in Iraq. Now you have almost 62, 63 IVF centers all over Iraq. And we actually have the latest technology. We have very good embryologists. We have very good reproductive medicine specialists. So I would say majority of Iraqi patients now they do their IVF in Iraq, and the minority they do their IVF overseas. In Iraq, we do almost 25,000 cycles a year, which is a huge number for a country who started just 6 years ago to have many IVF centers in Iraq. So yeah, actually many patients they are doing their IVF in Iraq. What we actually lack, and I mean, the field really lacks regulations by Ministry of Health, by local committees, societies. The IVF is not regulated in Iraq. So, for example, if I'm an embryologist and I have a gynecologist with me, we open an IVF center in Iraq. We can do whatever we want, whatever procedure, add-ons, we can receive whatever number of patients we want. So there's no regulations. Actually, we need a watchdog, or let's say a regulatory body, to put it better, to regulate IVF in Iraq. Yeah, but now Iraq is very, I mean, yeah, it's technically advanced when it comes to IVF. One last comment, I would say those who work in IVF and in embryology in Iraq, they don't really care much about quality control or the environment where the embryos grow, and especially given the the climate in Iraq, the hot weather, the dust, all of these all contribute to the success of the IVF, and that's why we need regulatory bodies. They need to put some rules and some guidelines so labs and clinics follow them.
Okay, so for people who have recently graduated from school, they would have limited knowledge about this specialty. So, how would you say it would be accessible for them to study in Iraq? Do they need to study abroad? Is it now available, or what pathway should they seek to enter this to become an embryologist?
Yes. So basically, I just want to clarify one more thing here is that if you decide to work as an embryologist in Iraq, so 80% of your work will be inside the lab, working in collaboration with a reproductive medicine specialist or gynecologist. So it's we actually don't treat patients. We actually see patients just to tell them about their embryos, to tell them about latest technology, to maybe counsel them about genetics. So it's a very heavy lab career, I would say, or job. There is, I think, the Higher Institute of Infertility in Al-Nahrain University College of Medicine, which gives a PhD and master's degree in clinical embryology, and it's open for biologists, pharmacists, and medical doctors as well. If you want to go outside Iraq, I would definitely recommend, one of the best countries in the world in the IVF field, and one of the first countries actually is the UK, Spain. You have very good programs in Australia, in the US as well. Also, one thing to add, embryology, there's the degree you get, but also there's the training. And now currently in the Middle East, there are a lot of training centers, especially in Jordan and in Dubai.
We've had many webinars and different type of doctors. We've had orthopedics and dermatologists. We always notice that students do ask about the financial status of each career pathway. Obviously, after very much of hard work, as you said, 80% of the time will be spent in the lab. How would you describe the financial status of an embryologist?
Okay, so compared maybe to an orthopedic or gynecologist is nothing, to be honest. But for lab-based jobs, for research-based jobs, it's one of the highly paid professions in Iraq. You get paid between 4 to 7K a month, 4 to 7K US dollars. So just to put it very bluntly.
We noticed also really interesting things while going through your CV. You've said you've worked on culturing human testicular and ovarian tissue to make a testicular organoid, and we were very curious into how that works. So could you expand on that for us?
Yeah, of course. So there's a when it comes to reproductive medicine and embryology, there's a part that is very close to my heart, and then like I think it's very humane and important part of the job is fertility preservation for kids and for cancer patients and all those who are exposed to certain dangers or certain uh, 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 um, exposures that will affect their fertility. So, for example, there are if you want to say if you want to preserve fertility for let's take women for example, due to maybe cancer or due to certain diseases that affect their fertility, you can freeze their eggs. Stimulate their ovaries, freeze their eggs, and then or if they have partners, you can freeze their embryos, and that's it. You don't really need to do anything. But there are certain patients who don't have time to start ovarian stimulation, to freeze eggs, or there are prepubertal girls who still not ovulating, and prepubertal boys who still not producing actually sperm. What we do, we take take part of their ovaries or their whole ovaries, or we take part of their testicular tissue and then we freeze them. And what typically happens after they finish their chemotherapy or radiotherapy, what clinicians do, they transfer or they retransplant that ovarian tissue back to women. So they resume their menstrual cycle, and they could be pregnant by natural pregnancy or even IVF. But this procedure, it's invasive and it has certain risk of reintroducing cancer to the body. So my work in Oxford with Susanna Williams, Prof. Susanna Williams group, what we were trying to culture ovarian tissue outside the body in the incubator, and we are trying to make eggs in the lab from immature follicles, which are called primordial follicles. So we take the tissue from the patients before their chemotherapy, we freeze it, and when they want to make their own baby, we take that tissue, we thaw it, we culture it for a specific period, and then we try to mature these immature follicles to reach a stage of mature oocytes. Then we inject them with a sperm, we make an embryo, then we transplant it back, waiting for a pregnancy. This process is still not very, it's still not successful. I think maybe in the next 50 years, we will use them. We will be able to make oocytes or eggs in the lab from either primordial follicles or from pluripotent stem cells. So yeah, for testicular tissue, it's the same. There are so many people who have azoospermia, men who have azoospermia, or kids who wants to go through again chemotherapy or radiotherapy. We take pieces of their testes, we freeze them. We hope in the future we can make sperm either in the lab or we transplant this testicular tissue after chemotherapy or radiotherapy, and then they resume spermatogenesis so they could produce sperm again. Hopefully that was clear. Please ask me any question you want.
It was clear, and as you said, going into the future in 10 more years or more will probably be more developed. Everything, today, every day there's something new. So, with that being said, do you believe the role of genetic engineering will not be only applied to IVF or not only applied in, for example, stem cell transplant to treat certain type of leukemia, lymphoma? Do you think more common diseases will soon be treated in the discoveries of genetic engineering in the future?
Yeah, well, look, I think engineering is not my let's say field of expertise, but I can very superficially comment on that. Uh, I would say genetic engineering is actually now uh, booming to treat diseases that are actually genetic based, for example, certain syndromes, for example, for HIV or for certain leukemias. I think we are more advanced to use genetic engineering in those diseases, especially genetic diseases, rather than IVF. In IVF, uh, it's still like there are a few people who are doing research on genetic engineering, but there is no baby born after genetic engineering, maybe apart from those two babies in China, and we still don't know if it's true or not. But definitely, genetic engineering has a big future in curing disease. I think it's very simple. So many diseases are due to uh, uh, some defect in a certain gene, and genes produce certain proteins. Either you have a missing protein or extra protein, and by genetically modifying these genes, you actually can either silence or maybe introduce a new protein. This is not my field again. Maybe I'm talking rubbish, but yeah, I think it has a great future when it comes to treat serious diseases rather than to make designer babies or to use genetic engineering just for the sake of making babies.
Um, I apologize if my pronunciation will be wrong here, but I see that you did apply to chevening. I'm not sure if that's how you pronounce it. Some people want to know how that process worked and how did you ace it. Many of our students would like to know.
Yeah, well, my lighting went because of electricity. Welcome to Iraq. Just I wanted to highlight this. And then answering your question, well, some people call it chevening, some people call it chevening. I call it chevening. So I think all work well. Uh, and I did actually after my undergrad degree, I did uh, a, a master's in clinical microbiology and immunology, and I worked on some research related to nanomedicine and nanotechnology. Then I decided, look, Omar, like I love science, I like fundamental science, but I want something that is really related to patients' care and to clinical side. And as someone who's mainly working in the lab, uh, the only branch I saw that I can actually be clinically involved was embryology. And then at my time, the only country that gives this degree was Australia, the US, and the UK, and only three universities in the UK. So I decided to apply for the Chevening Scholarship. I was eligible. I had 2 years of work experience, and then you need to apply. You need to do an application to write 4 essays regarding leadership, regarding networking, why you chose the course. So the only thing I want to say about Chevening, they don't really care about your marks. They don't really care about your average or GPA. They really care about your leadership qualities, your future leadership qualities. They invest in Iraqi youth to make leaders to lead in their fields in the future. So yeah, you write an application and then you are either shortlisted or not. If you are shortlisted, then you call for interview. Then the interview will ask you all about your application and experiences. And I think the main point they want from you that you will develop your own skills theoretically and maybe practically. In the UK, you will contribute to the achieving networking events, and then you decide to come back to Iraq to serve in whatever field you choose to. Uh, I always tell people like maybe it's there's a really thin chance to win the Chevening scholarship, because they receive like 1,000 something application, and then at the end they choose only 7 to 10 students. But if you don't apply, you never know if you're going to get accepted or not. Just apply, and I know some people applied 4 times, 5 times, 6 times, and they got the Chevening scholarship, because studying anything related to medicine is very expensive overseas. For example, my fees were like 34,000 pounds, which is like 40,000 American dollars, and it was very expensive, and it was all paid by Chevening. So it's a great opportunity actually, if you guys apply after graduation and gaining some work experience. And I think I can share with you guys something after the talk. I gave a presentation in Jordan when I was in Oxford on how to secure scholarships and how to write for universities and professors regarding scholarships. I can share the link with you, and you can share it with your subscribers.
Yes, sure. After the webinar ends, we will post the link on our channel. Now, as you were talking, I noticed that you've been to many different foreign countries. So I wanted to ask if, you've ever felt limited within your work in Iraq compared to foreign countries, in the facilities, for example. Have you faced any difficulties when compared? And if you have, could you tell us your experience on what difficulties someone may face if they are working this field in Iraq?
Yeah. So basically, I think looking at my CV, so my experiences around research and actually working in research labs rather than in hospitals and I mean, in healthcare settings. I worked mainly in research labs, biomedical research labs. So simply in Iraq, we don't have any fund or any research support from either universities or the government or any other organizations or parties. In Iraq, students, master students or PhD students, if they want to do their research for their thesis, for their degree, they need to pay the research expenses from their own pockets. They need to do the experiments in labs outside the university labs, because the university labs mostly are empty and not really well equipped. So it's very difficult to do research in Iraq, because you need to spend your own money, and then you don't really have infrastructure to conduct the research. You don't actually have the support to publish. Many people publish in predatory journals or journals that are not really well accredited, just because they don't know, not because they are bad researchers. For example, I went to Jordan to make my first master's degree. I was thinking I will pay from my own pocket for the research. Then my supervisor told me, write a proposal for your research idea, and we will get support from the university. Then I wrote my research idea, and then my supervisor proofread it, all these details, and then we got $21,000, which is more than my fees. I got $21,000 to spend on my research project, and I did amazing research project, and we published 2 papers from my work in Jordan. In the UK, the same. I did a research project with my master's. It was all covered by the program itself and the university. In Oxford, we get money from funding agencies, and we do the research from the money we get from those funding agencies, whether they are governmental or private. Like I would love to have actually some research facilities and research opportunities and funding in Iraq. Maybe we should not really look to the UK or the US. Maybe we should look to some of our neighbors who have funding programs that to fund researchers to actually do research. And I always tell my colleagues and people who work in research, please don't repeat fancy experiments done uh, by scientists who have $1 million to do research. In Iraq, first we need really baseline research. We need to our numbers. We need to know our numbers, our statistics. We need to know our epidemiology, our prevalence of certain diseases or certain syndromes or trends within medicines, rather than reinventing the wheel with the fancy experiments. So I think it's from within us, the researchers. We need to find our own goals, but also we need the support. I would say we have very, very, very limited support when it comes to research. So if you are interested in research, or if you want to see advanced technologies, or you want to actually gain experience in publishing and all of that, I advise everyone to get experience overseas.
Now, one more question, if you may, because we also have different questions in the
Sure.
comments. I don't know if
Try,
you've been.
I'll try to answer shorter this time.
Yeah, okay.
Please go ahead.
My question was about, the working hours, the pressure at work. Could you explain the social aspect of your job, if that's okay?
Of course. If you if you are very much into life-work balance, working as an embryologist in the Middle East, not only Iraq, is not a great idea because, for example, embryology is very, 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 very organized when it comes to timings and schedules. For example, you collect the eggs at 36 hours after you inject your trigger. And then when you collect the eggs 36 hours after the trigger injection, you have to inject within 4 to 5 hours of the egg collection. And then you have to check the fertilization after 20 hours or 16 to 20 hours after injection. And then you need after 72 hours, 48 hours, and until 5 days, you need to monitor these embryos in specific timings. Now there are technology to actually watch embryos develop from your own phone, but unfortunately, we still don't have this in Iraq. Some labs are bringing them. So yeah, embryology and gynecologists, they control your time. You don't have control over your time. When I actually studied in the UK and saw the practice in the UK and Europe, uh, uh, for example, labs who do 2 of them pickups a day or 3 of them pickup a day, they have 4 and 5 embryologists. So if an embryologist gets sick, if an embryologist have wedding, if an embryologist wants to go for holidays for 10 days, there is backup, always there's backup. Because we are very expensive, embryologists are very expensive. In Iraq, each lab, they bring only 1 embryologist. So you have to do the work while you have an IV line, while you are sick, while you have your, I don't know, your best friend wedding. Uh, it's very tough in Iraq. I'm
Uh,
not trying to make it very dystopian, but I'm here to give the facts, I think.
your
And
personal experience, and that's what we want to hear. It's true. Majority of the healthcare system jobs, it does take sacrifices. It's a very serious matter. We have a question here, and it says the Iraqi Board of Medical Specialties has recently started the Board التشريح والأجنة السريري program. Are you familiar with this? Do you think that this is a step towards standardizing and innovating the embryological sector in Iraq?
to be honest, my knowledge really, really limited to this. But I could see from people who are doing this fellowship or this board program, there are 2 pathways to work in embryology as a doctor or to work in reproductive medicine. You either get a PhD from the Nahrain University, the medicine school or the medical school, or you get the board after, I think, yeah, to get the board in embryology and in anatomy. How the board works, do they work in the lab or they work in the clinic? I'm still not sure really. It's still very young program, and if someone wants to go this path, they need to make sure they will work in the clinic or in the lab, because I think as medical doctors, you need at least maybe 60% of your lab in the lab and 40% of your work in the clinic for financial and for practice reasons. Just make sure that you have a clinical part in your work, not only lab-based. Hopefully this answers some of your question.
Yes, it was very thorough. Could you please now finally just to end this webinar, the most important thing for us today here is your advice from your, your personal perspective, your advice for people who want to join this pathway, your advice when it comes to the pros and cons in general. What are 5 or 3 main advices you would give us today?
Yeah, so it's very hard to get into this field. It's very hard to get training opportunities. Once you get a training opportunity, take it. If you have very high attention to details, if you are a very organized person who likes their timings, then this is the perfect job for you. If you like short term outcomes, this is the perfect job for you. But if you are more of, let's say, spontaneous, sporadic, you like to work according to your own pace, maybe this is not the perfect job for you. But I think it's you will always be, I mean, be flexible and adjust according to the job demands. I would just say knock all the doors. Like if you want to come to embryology, medicine, whatever field, if you want to get into research, if you want to go overseas, just knock so many doors. Try to find opportunities, network, uh, uh, try to participate in conferences. There are so many societies, they give travel grants for like $1,000, $800 to pay your flight and hotel to attend a conference somewhere overseas. Take these opportunities, network with people, know people, send them an email, try to secure internships. Yeah, I mean, generally, I would say these are maybe the tips I could give.
Thank you very much for your helpful tips today. You answered all the questions we had in mind in a very clear, honest way, and we really appreciate you being here, taking your time. Thank you. It's been really great.
No worries, no worries. Really, thank you for the invite. I really appreciate it. And please, I'm very happy to help anyone who have questions or any inquiries. I think you already guys have me on Instagram. You can contact me there. And I think my questions or my answers covered some of the questions in the chat. I'm seeing like can we okay, any success conception story? Yep, I think, I don't know if you want me to answer some questions from the chat, but if you have time or not, I'm very happy to answer.
We have all the time. You take your time, answer anything you'd like.
Yep, so there's a question regarding can we perform ovarian egg freezing? I think they mean egg freezing. Yes, we can perform egg freezing in Iraq, and we can freeze them up to 55 years. The only thing you need to make sure that you are going to a good lab, because oocytes are the hardest to freeze among cells and embryos, and you need to find a really good lab to freeze those egg. Can you share a success conception story you recently worked on? What factors do you inquire about? Do you advise the couple? I think I can share not very new one. There is a really very good new case, but there is a case that I always share with people. I had my sister's best friend. We did a very tough case due to male factor to her. From 15 oocytes, we got only one embryo. That embryo actually implanted, and she has a very beautiful baby now. I think he's almost 4 years old now. Yeah. I'm done. I think I answered all the questions, and thank you very much for your time. And yeah, looking forward to talk to you in the future.
Thank you very much for your time. Uh, that was a very nice.
Thank you, guys. Bye bye.
Okay, goodbye. Thank you for being here.
Thank you.